Good morning, this is Psychodynamic Therapy. This is Unit 6 for Psychology BTEC, and we're looking at Learning AIMC treatments for mental disorders. And we're looking in this video at the treatment that Freud came up with out of his theories for the causes of mental disorders being rooted in the unconscious mind and conflicts within the unconscious mind. And so he came up with a therapy known as psychoanalysis. So we're going to spend a bit of time looking at this and then look at the form of this which is used today, which is known as psychodynamic therapy. So Freud's original psychoanalysis was where he was looking at basically using techniques during a talking therapy to bring back any traumatic memories that had been repressed into someone's unconscious mind. That means you kind of store them away in your mind and you can't then examine them consciously. It's like you've forgotten. But psychodynamic therapy then, or psychoanalysis, uses three techniques: free association, transference and dream analysis, to try and access those repressed memories that we have. And so what Freud came up with was the idea of free association. And the idea is that the patient will just talk, basically. Whatever comes into their head, they just speak it out loud. And that's not by like editing it or thinking carefully about what to say. The idea is that they just talk. It's like a stream of consciousness. Whatever comes into your mind, you just say. And while this is all happening, the therapist will be listening really carefully and trying to work out, basically, as a result of listening to what you're saying, what's going on in your unconscious mind. The idea is that it provides insight into your unconscious mind. And then they will be able to offer any interpretations of that. So that's the idea of free association. And if you like, this might be a good chance to pause the video and actually have a go at this yourself. You could set a timer for 1 minute or 2 minutes or something, and basically just have a go at writing down everything that comes into your head. You can look through it afterwards and kind of see, is there any like threads you can see, any things that keep cropping up again and again, or have a go at analysing it yourself. So if you'd like to do that, then pause the video now. Right, a second element then of psychoanalysis is known as transference. So this is where what happens is the patient is talking to their therapist and they basically react to their therapist in the way that they would have reacted towards a parent or somebody else. So they react really strongly to something that the therapist says. And this is quite helpful for the therapist because it gives them an insight into what is going on in their unconscious mind, that if they're talking about a parent and they start getting really cross, that actually that's giving an insight into what's happening in that patient's mind. So what then the therapist needs to avoid doing is reacting back, which is known as countertransference. They have to try and avoid that, because then what you end up doing is mirroring that negative relationship that the client has elsewhere. So that's the idea here, is that the therapist then has to remain detached and remain calm and work out what is going on in this situation. Dream analysis then is the third element that happens in this therapy, and the idea is that you look at dreams that the patient has had, and you look at what's known as the manifest content, things that you can actually describe about your dream, and that's meant to then reveal any hidden meanings. So dreams really are meant to express what we have in our unconscious mind, according to Freud. And so you can then use that in therapy to then talk about any threads that have come out of it. So for example, let me put this dream on the board. This is about a dream about someone who dreamt about animals trapped in the zoo and helping them to escape. If you cast your eyes across that dream, you'll see it it's kind of a fairly common sort of dream that someone would have, but you'd want to explore with this person. Are they feeling trapped? Are they feeling the need to escape from something negative? And so you could take that back into their free association session and ask them to talk on those topics and see what comes up and where their mind takes them on one of those topics. Okay, so psychoanalysis, Freud's original therapy that he came up with, is a little bit different to what we now know as psychodynamic therapy. So just to be really clear on the difference between them, I've put the two on the screen here. Psychoanalysis would have taken place 5 times a week. You'd have to have someone who's certified, really trained to be able to do this sort of reading between the lines into what's going on in your unconscious. It's very difficult, skilled work. And you'd have the patient lying on the couch, not making eye contact with the therapist. Psychodynamic therapy uses several principles of it, and it is still used in a number of places in the UK today, but it's slightly different from that. So it would be once a week rather than 5 times a week. You'd have like 15 sessions, and you'd talk face to face in a more traditional way. But the principle there of the therapist trying to work out what's happening in your unconscious would remain the same. So what it would be really helpful for you to do at this point is to have a go at comparing psychoanalysis and CBT. And this is a really helpful thing because you need to be able to compare and explain the difference and evaluate them for your coursework. So I'm going to suggest that you pause the video now and use your knowledge of CBT, cognitive behavioral therapy, to think about what the role of a therapist is in that, and then write down what you think the role of a therapist is in psychoanalysis. So pause the video now and have a go at that before you carry on. Okay, so hopefully you got something along these lines for that task. In CBT, a therapist has a bit more of like a vigorous, or may have more of a sort of argumentative role. So, for example, the therapist would help you to identify negative thoughts, challenge them, discuss them. They'd be doing things like setting homework. It's quite active. They're thinking, is that a help? They're getting you to question your thought processes. In psychoanalysis, if we're talking about Freud's original version, they'd be doing more like listening without making eye contact, concentrating, thinking about what's being said, trying to stay objective. You can see it's quite a different sort of role for a therapist. So it's not just that the therapies are different, it's that the therapists have to do different sorts of things here. Right, let's briefly evaluate this then. So psychodynamic therapy, is it effective, is the first question. And we've got a study here that shows that actually when we compare psychodynamic therapy to a CBT group, it seemed in this 2015 study at least to be more effective than CBT. This is one study, of course. However, it does take a really long time. It's a really big commitment. And actually, when they've looked at it in Germany, they've shown that if they get treated for 2 years, the longer that they can be treated, the better the outcome for it. So there's a couple of studies there for you to know about in terms of how we've compared it to other treatments and is it effective or not. We found actually yes, it is effective overall when we look at it in terms of outpatient outcomes. However, your big weakness really of this study is that it only benefits people who are what we call YAVIS, youthful, attractive, verbal, intelligent and successful. If you think about something like free association, that really benefits someone who's good at talking, someone who's verbal, and who's intelligent, who's able to just keep talking and kind of analyse themselves a bit. And so this has been a big criticism that's been levelled at psychodynamic therapy, is that if someone is less good at talking or analysing, then it's often not that helpful. Okay, so hopefully that's been helpful to get to know a little bit about psychodynamic therapy.